One thing I wanted to quickly let you know is what is NATF Traveling Fellowship Program. Some of you know it and some of you may want to know it. So I'll read the excerpt which we have in our brochures, and that is with the goal of exploring the cross-disciplinary diagnosis, treatment, education, and research related to venous and arterial thrombosis. The NATF Traveling Fellowship Program is an annual scientific exchange opportunity for physicians, scientists, pharmacists, and other allied health professionals such as nurses, nurse practitioners, and physician assistants. NATF will provide an award equivalent to $7,500 for lodging and travel for one or more fellows selected to visit a North American medical research or education center of his or her choice for up to 45 days. So that is the first thing. Then what is our commitment in the NATF to future leaders who are our fellows? And we are very fortunate since the inception of this program in 2007 to have 10 very talented individuals competing among many others and winning this fellowship and publishing papers and disseminating knowledge and exchanging information. The NATF Traveling Fellowship Program was created in 2007 to allow scientists and health professionals, as I said, to expand the opportunity and their knowledge base, as well as build positive, enduring relationship with other concerned with thrombosis disorders, mainly a mentor which they select in different places. NATF recognized the vital impact of training programs have on future of thrombosis research, diagnosis, treatment, and prevention. And to date, we have awarded $67,500 in funding 10 fellows, besides helping them in many other ways. So I want to thank our president. The idea initially came from him, as he has always been fostering medical students, younger trainees, fellows, and he has a passion to really help them. We're very fortunate to have 3 of our past fellows from last year here: Dan Adam, Kurt Meehan, and Inder Mohan Titi. Can you please stand up if 3 of you are here? Kurt, I can see you and Inder, but I don't see Dan. Okay, you see there. And the man who inspired us in creating this fellowship has to give these awards, and beside the executive director standing here, Sam, I have to ask you to come here, please, because you are the guy behind this. So we get a lot of applicants, and we have a lot of competition in this area, and it's a hard job to select. But of course, we took a consensus from our committees. And this year's fellow is Dr. Palladino. Dr. Palladino received his Doctor of Pharmacy degree from Temple University School of Pharmacy in 2006. He began practicing as a clinical pharmacist in internal medicine and then worked as a clinical pharmacy manager at Northeastern University Hospital, Temple Health System. Following his time at Northeastern, Dr. Palladino began work at the Thomas Jefferson University Hospital, where he developed a pharmacy-managed transition of care program. This program utilizes pharmacists to educate, monitor, and adjust anticoagulants in orthopedic joint replacement program. To date, Dr. Palladino has continued his excellent work in his role, and in 2010, his transition of care program won the ASHP, American Society of Hospital Pharmacists, Pharmacy Best Practice Award Dr. Palladino is also working towards his MBA at La Salle University, getting a degree in business, and expected to graduate in 2012. Now, what is he going to do with this fellowship if he accepts this fellowship from Dr. Goldhaber? As of 2011, as a 2011 traveling fellow, he will work closely with Dr. William Dager, PharmD, BCPS, at the University of California, Davis Medical Center to develop a transition in care program for the treatment of thrombosis patients who will be managed by the Thomas Jefferson University Hospital Anti-Thrombotic Service. The program will employ a multidisciplinary team of physicians, nurses, appropriately educated on anticoagulation management and plan of care. Dr. Palladino hopes that by fostering improved communication between inpatient and outpatient clinicians, a safer and more effective and hand-off process can be structured to ensure each patient in being managed correctly in the outpatient settings. And I think that this is one of the objectives we have, is to optimize patient care. And Sam, thank you very much for identifying this particular issue, which of course is one of the objectives of our organization is. So do you want to say a word about Dr. Palladino, or?
I think you said.
Okay. Dr. Palladino, where are you?
Today was a great learning experience. I have much to learn, and probably not the only one here that has a lot to learn, but this has been outstanding. A few years back, I came to Jefferson Hospital and was lucky enough to work with Dr. Murley. In Dr. Murley's program, we started a transition of care program in the orthopedic population, and I think one of the things we learned is, wow, we have so much to learn, and there's a lot of room for improvement when transitioning patients from a hospital setting to an outpatient setting. So hopefully we can take some of what we learned there and move it to our VTE practice and our VTE patients and really improve the way those patients are cared for. Thank you.
Well, the second recipient, somebody I know of academically, as I have reviewed some of his work and impressed by him, Dr. Rondina. He graduated from the University of Utah Medical School in 2003. He completed his residency at the University of Utah, where he was chief medical resident from 2006 and 2007. Then he joined the faculty in the Journal of Internal Medicine at the University of Utah. During his short time as a faculty member, he has already begun establishing a track record of successful NIH funding and translational research in the field of thrombosis, focusing on platelets. His research grants include the K-12 Scholar Award and subsequent the K-23 Career Development Award to characterize novel mechanisms linking inflammation and thrombosis. We today heard about aspirin and its potential therapeutic effects, and Dr. Goldhaber pointed out that it may be related to inflammation. So hopefully Dr. Rondina will continue to explain to us whether this is the real mechanism or there are some other mechanisms. Currently, he is a director of Translational Research Division of the University Healthcare Thrombosis Service. So, as a fellow, traveling fellow, he will collaborate with Elisa Wahlberg at the University of North Carolina, Chapel Hill to develop a better understanding of the key cellular responses in obesity and how they contribute to the prothrombotic milieu. Dr. Rondina's work will lead to improvement in the prevention of atherothrombotic disease and its complication. Matt?
Thank you very much. Of course, I'm very pleased to be here and accept this and appreciate the kind support of NATF as well as the committee members who reviewed the grant. As we heard from Greg earlier today, obesity is a risk factor for atherothrombosis. It's interesting to me because it links both inflammatory and thrombotic disorders. It's a disease which affects millions of people worldwide and, of course, is of increasing prevalence, both in industrialized and developing countries. My work will focus on understanding some of the cellular mechanisms of how platelets and monocytes interact to induce a pro-inflammatory and pro-thrombotic state, which contributes to the risk of thrombosis in patients with obesity. I'm pleased to report that I've just finished my first week at UNC working with Dr. Wolberg. We've started to develop some assays to look at these interactions and are developing some pilot data, which hopefully I'll have the chance to present in the next year or two. Thank you very much.
So I think we are done with the festivity. I have one ad hoc comment, and that is that these fellows have done good work and they are publishing their work, but being young people and open-minded, they're already saying that the amount of money given to them is, of course, is a token and greatly inspires them. But to continue this work, what other mechanism they should approach to get more funding? So we at NATF will try to strive for additional fundings from our own sources, but certainly they are competitive and they will get grants and so forth. So your contributions to NATF and any ideas you have in that regard will also be very much appreciated. Thank you very much.